and welcome to the Practice Management Study Club. Today's topic is case presentation, how to increase case acceptance. Your presenter is Sandy Belarjon. And with that, it is my pleasure to introduce Joanne Friedman, Territory Sales Manager for all of Canada. Take it away, Joanne.
Thanks, Jessica. It's my pleasure to introduce Sandy Belarjon. Sandy's a leading authority on how to increase the effectiveness of dental business systems. Ms. Belarjon is the author of 3 textbooks, Dental Office Administration, first and second edition, published by Top Hat Publishers, and the Canadian Dental Office Administrator, published by Nelson Canada. She created the first certificate course in dental practice management at the University of Toronto, Faculty of Dentistry. Sandy has lectured at dental faculties across North America and has had articles published in many journals, including the Journal of the Canadian Dental Association, Oral Health, Spectrum Teamwork, Just for Canadian Dentists, and many other publications. As owner-operator of Dental Office Consulting Services, Sandy specializes in dental practice management, consulting, hiring, coaching, and training dental teams. Also, implementation of in-office programs, dental business, and operational plans. It's my pleasure to introduce Sandy Belarjon.
Thank you so much, Joanne. And once again, it's a pleasure to be with you tonight. And I'm so happy to be able to present to this Practice Management Study Club, and thank DSG and DX for bringing this together. You know, without their support and their brainchild, really, of all of this, this wouldn't be happening. So I'm very appreciative of that as well. Just wanted to fix something here. Okay, great. So tonight we're going to talk about case presentations and how to increase case acceptance. As you are aware, many dental treatment plans are presented to patients and they don't necessarily follow through with them. Because of the fact that they are asymptomatic. So it makes dental treatment planning and case acceptance much more challenging. So the objective, of course, of any case presentation is to create acceptance of the treatment, of the conditions that you have diagnosed in the patient's mouth. It's a critical time for the patient to make the decision on whether or not to buy into the treatment plan and make an investment in their oral health. But keep in mind, this is not a selling situation, even though I will be using that term from time to time this evening. It's, excuse me, you are really influencing the patient to understand and believe that the need for treatment and show them the path on how to follow through with the treatment. So what you will learn tonight is what should your case acceptance rate be, how to present treatment and demonstrate the path forward for the patient, how to make financial arrangements at the time of booking the appointment and why that's so important, and then finally how to close the sale. So that's where we, as I say, we will be talking a little bit about selling, but it's not a sales presentation, and you will see that as we go along. So the most important thing that you can do as a dental provider is to manage your patient's expectations. And this takes everybody in your entire office. Everyone is involved in managing your patient's expectations. So, so everybody plays a significant role in this process. So what do your patients expect when they come to your office? They come to your office expecting a diagnosis and treatment plan. Otherwise, they would be somewhere else. They would be doing something else. So you have to keep that in mind when you are seeing your patients. They expect you to facilitate the treatment and to guide and direct them. One thing that I talk to dental office personnel about all the time is not to ask the patient too many questions. For instance, I was at an office the other day and I heard one of the reception staff saying, you know, when would you like to come in? And that's one of the worst things that you can do. Your patients expect you to guide and direct them. If they need the treatment, then guide them through the process on how it works and make their appointments, get their financial arrangements prepared, and so on and so forth. But don't expect the patient to make those decisions. Plus, if you ask them when they'd like to come in, it looks like the schedule is wide open and that the patient can come in at any time, which also means that the patient can cancel at any time. Also, never prejudge your patient's willingness or ability to follow through with the treatment plan as prescribed, or to pay for their treatment plan as well. I find in a lot of offices that that is the prejudgment of the staff that is actually affecting whether or not the patient follows through with the treatment. And we'll discuss that a little bit further tonight as well. So turn recommended treatment into prescribed care, and you will make a major difference in the way that you're presenting your treatment. The reason I say this is because if you are recommending treatment, it just sounds a little bit wishy-washy. Now, I understand that you may be thinking, well, the patient has to make an informed decision, and it is their decision whether or not they want to follow through with treatment. And that's absolutely correct. And the fact is, when you prescribe treatment, the patient always has the ability to make the decision on whether or not they want to follow through with the treatment. So it works exactly the same way, but just turning it into, changing that one word, the doctor has prescribed treatment, makes a much stronger effect on the patient than recommending. Because I can recommend a good restaurant, for example, I can recommend a good movie, but if you are prescribing treatment, that's a much stronger statement to the patient. Is it the right thing to do? Many dental professionals feel that they have an ethical obligation to offer their patients every treatment option, regardless of their opinion of the patient's willingness to accept the treatment or ability to afford it. And think about this: if you have diagnosed a condition in a patient's mouth and you are prejudging, I'm not saying that you are, but if the person who's presenting is prejudging and assuming that the patient isn't going to follow through with it, they'll have a much less effective case presentation, and that's not really fair to the patient. You need to tell the patient everything about what treatment that they need and what their options are. Remember that your patients trust you. They depend on you to offer the best possible treatment options and to maintain the patient-doctor relationship within your office. Remember, there's a lot of competition out there. They can go to various offices. And everybody's trying to get your business as well, your patients. So guide and direct your patients. Don't ask too many questions, as I already mentioned. Break down the barriers to communication and provide your patient with the access to care. That's really the whole idea behind treatment coordinating or case presentation, is the fact that you are helping your patient to get the care that they need. And really, if you have that mindset, it will help with your case presentation immensely. Don't let insurance benefits be a restriction to your patient's care. And that's what insurance companies love to do that. I could go on and on about insurance companies, but I realize we only have an hour together tonight. So the fact is that insurance companies are financial institutions. They want to influence your patient enough that they will not follow through with treatment. So the insurance companies will keep the benefits, and the patient doesn't get the care. In other words, the claim isn't paid out. So that's really the idea behind that. But that's not fair, once again, to the patient, because that's restricting them from getting the access to the care that they need. Offer alternatives to insurance. For example, offer a payment plan. In our next webinar in September, we're going to be talking about how to make financial arrangements, as well as I'm going to present something to you, a little teaser for the September webinar, and that is do-it-yourself dental financing plus a direct payment to the dental office. So something to look forward to in September. It takes an entire team, just like it takes a village. Everyone plays an important role in the overall care of the patient. So therefore, the messaging really needs to be consistent. From the front desk to the clinical assistant to the hygienist, everybody needs to be telling the patient the same thing and saying the same messaging, positive messaging to the patient. Remember, your patients expect every person who's involved in their care to know everything about their care. I've seen patients come to the front desk, and even though the receptionist may or may not have the chart in their hand, the patient automatically expects the receptionist to know everything that was done in the operatory 5 minutes ago. So, it's very important to manage your patient's expectations. The major challenge we have in dentistry, as you know, is that most conditions that are present are asymptomatic. So you see them, but the patient's not feeling anything. So that's a little bit of a tougher discussion with your patient. If the patient doesn't feel anything, They don't think there's a problem. I can't tell you how many patients I've heard say, well, the only time I go to the dentist is if something hurts. Well, healthy teeth shouldn't hurt, and healthy gums shouldn't bleed. And the fact is that if there is pain, as you know, it's usually an acute problem by then. So it's important to use as many visual aids as you possibly can, because seeing is believing. And the fact is that I think intraoral cameras are probably the best educational tool that you could possibly have in an office. But I have been in offices where I see them with dust covers on them. So I think every operatory should have an intraoral camera and use them for every appointment. You know, just show your patient. Patients love to see inside of their mouths. They love to see their x-rays, even though they can't read their x-rays. So the more visual you can make your presentation, the better. And also, believing is seeing. Now, that phrase I took directly from the Santa Claus movie, which was many years ago, but it's true. Believing, they need to believe you. Your patients need to believe what you're saying. They do believe you. They trust you automatically as the expert, but you really they need to believe that they actually have a problem if they are not having symptoms. So why will people come to you for treatment? Because they believe you, because you have built a relationship with them, and that relationship is built on trust, and they like you. If patients like you, they become friends with you. You become on a friendly basis, and basically, people believe their friends oftentimes more often than professionals or scientists or science, for that matter, in some cases. So it's important to develop that believability and trust with your patients. If your case acceptance rate is currently at 50% or lower, does that mean that 50% of your patients don't believe that there's a problem? So that's one scenario. Or the other scenario is that did the treatment plan fall through the cracks and it's not followed up on? Keep in mind that patients will, their memories are very short. They may remember what was said in the operatory, and then by the time they get into their car, they've forgotten half of it. So it's very important that your dental team follows up with that patient as much as possible and in a timely manner. And I'm going to talk a little bit about that so you can work around insurance companies, because they want you to take your time. They want the patient really to think about this and to make an informed decision on whether or not they want to spend their money on their health or if they want to spend their money on something else. Remember that patients buy with emotion and justify with logic. And basically how I've made most of my purchases during the pandemic, that describes it in a nutshell. But it's true, there has to be an emotional element to it. There has to be a compelling reason for the patient to follow through with the treatment if they don't have symptoms. If they have symptoms, then they're going to be there. They're going to want you to fix the problem now. But if they don't have symptoms and you can see that a problem exists in their mouth and that it's going to get worse, then you need to be able to tap into emotion with them and compel them to follow through with the treatment. So what is a good case acceptance rate? Obviously 100% would be great. Every time you tell a patient that they need to have treatment, that they follow through with it. But 80% is more realistic, and 80% is absolutely doable. It's doable if you have the right system in place. You have people who are dedicated to this whole entire process. Ideally, it would be also nice if you have a dedicated treatment coordinator who is following up with with all of the treatment plan. So the key to case acceptance really is follow up and follow through. And that happens on the part of the dental office, not necessarily with the patient. Because just to give you an example, if you send out a predetermination, pre-estimate, the insurance company will deliberately take 4 to 5 weeks to send an approval to the patient. And they do this on purpose, and they send it through snail mail. Now, the reason for that, and think of this, we're in instant messaging age, so there's no reason that they couldn't speed up that process. But they deliberately delay that process for the specific reason it allows the patient time to change their mind. And I know part of my dental experience in the past 38 years has been working with dental insurance companies as well. And I know for a fact that they do this on purpose. They actually write it into the policy. They put a predetermination policy, or predetermination process in for specific things. If, let's say, for example, root canal, they'll put a predetermination process in for that. And the reason is to slow down the claim. It's all financial. It's all about money with the insurance companies. So they deliberately delay the responses to the patients so that the patient will change their mind, because something more important will come up, and they'll want to direct their financial resources to something else that has come up in their life. And remember, they're not feeling symptoms, so they're thinking, well, you know, that can wait. That can wait, and something else more important came up. So don't let your insurance companies get away with it. You know, it's not fair to the patient. And keep in mind, this is something I always talk to offices about. The fact is that patients have already paid for these benefits. They paid for it, even if their employer has paid for it. The fact is it's come off of their paycheck in one way or the other. So they've already paid for these benefits. And now insurance companies dare to deny the claims. So don't let insurance companies get away with it. Work with insurance companies as much as you can, because I realize I do live in the real world. You have to deal with these people. But the fact is that you are your patient's advocate. So you're trying to do the best you can for your patient to follow through with the treatment. And giving them lots of options is very, very helpful. Why do patients stay with your office? Because they trust you. They trust that you have told them what they need. They have a relationship with you. And remember that dentistry, the business of dentistry is a relationship business, and it's built on trust. That's the foundation of any solid relationship. And remember that people will believe their friends whom they trust over necessarily insurance companies who they don't necessarily trust. So remember that strangers will tell you what you need. Friends will help you discover what you want. And what you want to hone in on when you're doing a case presentation is what the patient wants, because that's the emotional aspect. That's not what a patient needs is the clinical side, what that you can see, but they are not necessarily seeing, nor are they feeling it. So you want to be able to hone in on what the patient really wants. I'll just give you an example. I was in an office one time where the treatment coordinator asked a patient, he came in for, I forget what he came in for, but anyway, he needed some restorative work, I think. And she asked him the question, and she said, you know, if money were no object, what would your goal be for your oral health? And he said, well, I'd like my teeth whitened. And her answer was simple and beautiful. And she said, great, you came to the right place. And that's exactly what's going to happen. But first, this is what we need to do. So she said, told the patient right off the bat, you're going to get what you came here for. However, he was also a smoker. He had some gum issues. And she said, you know, we're going to take care of these gum issues. So then when you do have your teeth whitened and your restorative work is completed, then you're going to get the results that you're looking for, and it will be long lasting and that kind of thing. So I think the key there is to let the patient know that they came to the right place, that they are going to get what they actually want. Your job or your goal is to really hone in on what it is that the patient wants. And you do that by asking open-ended questions. So that's, and open-ended questions start with who, what, where, when, why, and how. And I do have a series of questions in the new patient experience that I have. I didn't include it in your handout tonight, but some things that I have included in your handout, I'll talk about as we go along as well. So how do you create believability, especially when you've just met the patient? And that is eye contact, okay? So eye contact and just natural open gestures, smiling, having a pleasant expression on your face as you're talking, is all of these things are help to make the person that you're speaking with believe what you're saying. Having confidence in using positive body language. Don't use closed gestures. Use open gestures as much as possible. Remember your facial expression. And the reason that that's important is sometimes your prejudgment can come through in your face. Sometimes if somebody says something that is contrary to what you're discussing, you can, furrow your brows, or you can be tense in your face. So just make sure that you are very open and have very confident body language. Try to show proof, show examples of other cases that you have. Show some testimonials if you have them available. So just have some nice before and after pictures. And I will tell you a little trick. I'm going to show you a picture in a couple of minutes, but a little trick about when you're taking photos in office, don't take the mouth stretchers for the clinical reason that you need that mouth stretcher picture, but try to take a portrait picture of the patient. So take a picture of their entire face, not just the mouth stretcher. And also, if you're taking a portrait picture, to tilt the head a little bit, because you get a much different picture than you get from taking a picture right on. And I'm going to show you an example of that in a couple of minutes as well. So here are some rules for case acceptance. Establish and maintain a positive attitude at all times. When I'm working with an office and we're hiring a treatment coordinator or training a treatment coordinator, I always look for somebody who has an interactive personality, who really truly loves dentistry and loves what they're doing, and who loves to talk. It's very important to have somebody who has an open personality that really is interested in people and who talks to people. I have a good friend in dentistry, and she was working as a treatment coordinator several years ago. And the doctor, she had a couple of men and women in her consult area, and she was in there for almost 3 hours talking to the both of them. And the doctor now is getting anxious, and he's kind of, pacing back and forth. And anyway, when she came out of that almost 3-hour consultation, she said, I just sold a $70,000 treatment plan. Now, I think a $70,000 treatment plan is very worthwhile for 3 hours of her time. Even though the doctor was getting a little bit anxious, he thought she was just talking all the time. She was talking. She was building a relationship. And the key thing there too is she had the two people who were the decision makers, because the $70,000 treatment plan is a family decision, not just an individual decision. When it was the husband and wife that were speaking with her. So establish and maintain a positive attitude at all times. Even if you're having a bad day, try to just take a deep breath and smile, and it really makes you feel better anyway. Believe in yourself and master the total knowledge of all of your services. So your treatment, if you have a treatment coordinator, if you're working with one, or whoever's at the front desk, it's very important that they have a complete knowledge of your services. And listen carefully to what a patient's saying and address those needs first. I had a doctor at a seminar that I was giving several years ago, and he came up to me and he said, God gave us 2 ears and 1 mouth, and we should use them in that proportion. And I've never forgotten that. I thought it was a beautiful expression. But the fact is that listen to what your patient is saying. You know what the patient needs clinically, but if the patient is looking for, I want whiter teeth, I want prettier teeth. I'll just give you another quick example. I had, there was a patient in a downtown Toronto office who went into this office, and he wanted a crown put on a specific tooth. I guess it kept breaking down, and he was tired of having it filled over and over again. So he wanted this crown. So he went into the office, and they gave him this huge, gigantic, comprehensive treatment plan. He certainly needed a lot more than the crown, but he wanted the crown. So remember the lady who said, great, you came to the right place. Do the crown first, and then tell them, when you're ready, you also need this, this, and this, but we take it one step at a time. So that's important, to listen to the patient very carefully and to identify that they are getting their needs met. That's really important. Now they're listening with both ears. So there are 3 steps basically to case acceptance, and that is to create awareness of the problem that the patient may not be aware of because of the fact that they don't have symptoms. co-discover with the solution with the patient, because when they think that they're part of the discovery process and they're part of they can't diagnose, but part of the diagnostic process, then they're more willing to buy into the solution. And then finally, close the sale. Now there's the sale word again. Even though you're not selling, you are educating the patient, but you do have to gain commitment. So when I say close the sale, what I'm talking about is gaining commitment, not just emotionally, but financially as well. So that's a key part of the whole process. So starting with creating awareness, as a dental provider, you see the clinical need. Of course, patients can't self-diagnose. So you see the need for treatment, but there are many conditions that are asymptomatic that the patient doesn't see. A good example would be, periodontal disease. They may not necessarily see or have any symptoms or feel that they need anything. You could see a cracked tooth at the back of their mouth. I've also had patients who have said, well, it's at the back, nobody sees it. And you as dental professionals understand and know, of course, the back teeth molars are so critically important to the occlusion and all of that. The condition that you see isn't causing any discomfort to the patient, so he or she doesn't know that there's a problem. So that makes your discussion even more difficult if the patient isn't aware of anything. So part of your job is to help create awareness. And that's where, once again, intraoral cameras are perfect for this. You can also ask them for certain questions. Have you noticed a bad taste in your mouth every once in a while if you've got a leaky, filling at the back or whatever? But asking them specific questions helps to create awareness with the patient. Don't overwhelm them with a large comprehensive treatment plan where there may be conditions that they're not aware of, and then all of a sudden they have this massive expense. Just as a follow-up, that gentleman that in the Toronto office, he left that office, went to another office which was very close by, and got his crown done. So just giving another example, I was giving a lecture one time and I was talking about every time the telephone rings, it could be a $7,000 treatment plan. And this was at the university, and one of the ladies at the front, she put her hand up, she said, I can do better than that. And she said, I had a patient call me, and he is a gentleman, and he asked how much a crown was, or whatever the treatment was. And she said, I can't diagnose your condition, but what I do invite you to do is come into our office, no strings attached. I will introduce you to the doctor. I'll give you a tour of the office, and then if you're feeling comfortable, we can talk about things. You can meet the doctor and perhaps set up an examination. So she invited him in without any strings attached, and that gentleman did go into the office and followed through with a $10,000 treatment plan. So the whole point of that is she invited him in. She did not diagnose over the phone because obviously you cannot do that, but she invited him in without any conditions, and just to meet and greet and to start developing the relationship. So that's really important. Co-discover solutions using as many visual aids as you possibly can, because people believe that the solutions that they discover more than solutions given to them by others. So if they see this the solution blown up on the big screen and right in front of their eyes, then it's much more easy to get them to follow through with the treatment. Patients only buy solutions to problems that they know they have, and that's why creating awareness is so important. Do not start talking about treatment or the solution, in other words, of a problem that the patient isn't fully aware of. And the way you create awareness is through visual aids, plus also the way you're communicating with your patient. Don't start talking about treatment of a concern that's your concern, because you can see that periodontitis may be starting to set in, but the patient is talking to you about a crown or asking you about a crown. So once again, great, you came to the right place, and in order to make that crown that you want, to make sure that there's a good solid foundation, we're going to work on your gums and make sure that they're in really good health. So creating awareness If the patient's unaware of an existing problem, don't talk about that first. Talk about what they came to talk to you about. That's why the listening is so very, very important. Because if you start talking to them already about their periodontitis, when they're in their mind, they want that crown, then it becomes pushy. Then it turns into a sales experience. It seems like you are trying to sell them something. Patients don't not necessarily want to be sold on something, but they're also willing to buy if they see value in the services. So it makes the patient feel that you're selling if you're too pushy about that. Give them as much information as you possibly can and help them to make an informed decision, as well as help them to see the path forward as well. Use visual aids to create a virtual reality for them. So this again is a three-step process. Get the patient to see the problem, and then they will buy into the solution. Create a crisis, in other words, a sense of urgency. And then use closure statements. That's the closing the sale portion. Use your technology. Remember the intraoral cameras. Patients often have not seen what a cavity looks like. So you may know that it exists. You may see a crack in a tooth, for example, and you can see all kinds of things that are going on with that tooth. But a patient's not feeling anything, so they're not going to be able to see anything nor be able to believe it yet. If you show them something blown up on the big screen in the operatory, then all of a sudden now they've got a visual of this and they can say, you know, wow, that looks really terrible. I want to get that fixed. So get the patient to see the problem. In other words, you have a cavity. This is what a cavity looks like. I've seen in some offices where they still use the little mirror and the hand mirror, and it's not as effective, number one, because you can't really see and it's awkward. But the other problem is that they don't know what it looks like. They don't know what they're looking for. You do, because you are the dentist. Then create the crisis. If you wait to have that fixed, it may become more extensive, or you may require more extensive treatment. Patients understand that extensive also means expensive. It means more time away from the work, more time away in the chair. So if you wait to have it fixed, had one dentist who had a brilliant statement, and I believe I put it in this presentation, and he said, well, you have a choice. You can either wait until it breaks, or I can fix it before it breaks. And I love that statement. I thought it was simple, to the point, and brilliant at the same time. So then make a positive assertion. This is your closure statement. What I'm going to do is I'm going to fill that with a white filling that is virtually invisible. How does that sound? So you can see that the doctor in this particular case didn't necessarily talk about the features. Well, it's going to be a resin filling, and you know, we need to do this and this and prep the tooth. But he said it's a white filling, he or she said, white filling, and it's virtually invisible. He or she is showing the benefit to the patient rather than the actual features of the filling. So if patients can see the problem, they are more likely to accept the solution. And now they're listening when they can see their own conditions that are present in their mouth. I love these pictures. I don't usually show pictures of my relatives. However, bone loss, when you're talking about implants, you're not talking about replacement teeth, because you can be talking about dentures for that matter. But bone loss, implants stop bone loss. And that's really the focus that you want to do with the case presentation. Why does bone loss affect people? Because of the fact that you can see how the nose and the chin start coming together when they lose their facial profile. When patients see their facial profile changing, that is the emotional aspect to that treatment. And then you've got something more to talk about. You don't necessarily need to show these pictures. But I would show pictures of real people. This is a real lady, and I'm going to point out a couple of things in this. When I first saw this picture, I thought she was much, much older than she is. And this is her picture after. But she lost her teeth fairly young. She was only 17 when she lost her teeth. And these are compliments of, or courtesy of Dr. Rayton of Straumann. And the fact is that this shows a dramatic difference. There's lots of examples of these type of pictures. Something else I want to point out to you, by the way, she's 49, which I think is pretty young, and you can see that she's very young and youthful in the second picture. I realized in the second picture that she's got some makeup on, her hair is smooth. Also notice that her chin is tilted. This makes a big difference. I worked with Rita Bauer at the University of Toronto, who's a clinical photographer, and she's amazing. If you ever get to one of her seminars, you're going to love it. The fact is that she came into one of my seminars one time and was actually taking pictures of the participants and showing them the difference in taking a picture right on, and that's this picture on the left, and then tilting their chin and just repositioning the person, and you get a totally different look. So that's something to keep in mind when you're doing before and after pictures. And these are the type of pictures that the patients actually want to see. They don't necessarily want to see the tooth stretcher pictures, portrait pictures of how it affects their lives. That's much more important. Use active verbs as much as you possibly can. Mr. Jones, you have an active infection in your gums. That requires treatment. Instead of saying you have periodontitis or early periodontitis, you have an active infection. Most people that have an infection in their body want that infection treated. Mrs. Smith, your tooth is breaking down. I can fix it before it breaks or wait until it breaks. And that, as I say, I attribute that. And I wish I could remember the doctor's name, but it was just, I'm sure you've heard that phrase before. And I thought it was just perfect and simple and brilliant. Mrs. Smith, you have active decay present. This condition will continue to progress and become worse if it's not corrected. So telling them that they have active process going on. So you have active decay present. So teeth don't repair themselves. There needs to be some intervention. And then for something that's asymptomatic, say for example, a crack in a back molar or something, and say, you know what, Mrs. Smith, as I was doing the examination, you can see that there is a crack in that tooth at the back. When you're ready, it's not causing you any problems right now, and you know we have other things we can work on right now. But when you're ready, this is something that we will address. So using very positive language with the patient, letting them know that you're not going to, you know, push them to get this work done right now. But when you're doing one step at a time, you're building the trust. At every treatment that you perform on a patient, you're building their trust. Start to think like a patient and put yourself in their shoes. What do you expect when you go to the dentist, your dentist, or a medical doctor, for example? You expect, I'm going to use medical doctor as an example. So you expect them to give you a diagnosis and a treatment plan, and you expect them to follow through with the treatment. So that's an important thing to remember. So what motivates you to follow through with the treatment? And this is the discussion that you can have with your staff. Makes for a good staff meeting, you know, something interesting for your staff meeting. Remember that case acceptance begins in the operatory. So every single person in your office has a part to play in this. The patient needs to hear the diagnosis from the doctor or a hygiene diagnosis from the hygienist. That's extremely important. So when you are doing the examination, hearing it come from the doctor, so they're seeing as you're doing the examination, and remember the patient's lying in the chair listening. So this time don't put the earphones on. If you're doing the actual work, then you might want to have the earphones on, but especially if it's a new patient and they're just hearing your voice for the first time, it's a really good thing to hear what the diagnosis is. The doctors cannot follow up with insurance companies and make financial arrangements, etc. I mean, technically you can, but who's going to? It's a lot of work and it's very time consuming. So that's why you have administrative staff, a treatment coordinator, front desk coordinator, and that's why they play such an important role. And the key is following up. And then close the sale. It's important to make financial arrangements before the treatment is started. I'm a great believer in this. When I train a treatment coordinator, I always train them to get the financial arrangements made before any treatment is started, and preferably to have a down payment, to put a down payment on that treatment. And the reason is because if a patient has put money down for the treatment, they're going to show up to that appointment and they're not going to cancel because they've already paid you some money. Doesn't have to be a huge amount, but it has to be substantial enough that it will motivate the patient to make sure that they follow through with the treatment. And remember, when the doctor makes any irreversible change to a tooth, there's no turning back. So once you put the drill to the tooth, you're going to have to do something. You're going to have to finish that treatment. And if financial arrangements aren't in place, if you haven't collected a deposit, then you could be wasting your time and wasting a lot of money. So follow up and follow through is really important. When treatment that falls through the cracks when it's not followed up with, and remember that you are putting your hands in or playing right into the hands of the insurance companies, because that's what insurance companies don't want you to do. They do not want you to follow up with the patient. They don't want you to follow up with the insurance company and to make the patient follow through with the treatment, because then they have to pay out the claim if it's an insurance claim. It loses its importance in the patient's mind. And this is what's so really important. Remember, if they're not feeling symptoms and they haven't heard from you in a month, then the chances are that the patient thinks, maybe I didn't need that treatment in the first place. I was in an office one time where we were going through the morning huddle, and one of the hygienists asked, she said, I've spoken to this patient 10 times about this crown that they need, or whatever the treatment was. And she said, how many times when do I stop? And I said, you don't stop. You don't stop, because it could be on the 11th time that something has changed in that patient's life circumstances, or if at that point, if you really want to stop, then I would say to the patient, Mrs. Smith, I've talked to you several times about this crown. The condition seems to be getting worse. I just want you to know, if you want, I'll stop talking to you about it. It's not going to change the condition. So there are different ways to get around that, but you're not pestering the patient. If you're telling them the truth that they need this service done, then that's not pestering them by following up with them. It's helping them. When a patient leaves your office, the importance of the treatment that you have just recommended or prescribed will diminish within 24 hours. Remember, they're not feeling symptoms. If they're feeling symptoms, they're yours. But if they're not feeling symptoms, then it loses the importance. Well, maybe, people suffer from buyer's remorse. So, maybe I don't really need that treatment, or maybe it can wait right now because there are so many other things that I need to think about. So that's why the follow through is so important. Insurance companies depend on this. If they don't send the approval for several weeks to the patient after the estimate has been sent, so they do that deliberately, as I mentioned earlier. And so it's very important. When I train a treatment coordinator, I tell them that to condition the patient, manage the patient's expectations, and I would say, Mrs. Smith, I'm going to send a pre-estimate on your behalf to see what your insurance might assist you with. And in the meantime, I will be calling you in 2 weeks to see if you've heard from them. Now, keep in mind, I said 2 weeks, and those of you who are listening who have gone through this process, you know that insurance companies will take 4 weeks, sometimes longer. So the reason I said 2 weeks is because you want to circumvent the process from the insurance company's perspective. You want to make sure that you follow up with that patient. Plus, it also helps the patient to realize that you really care about their dental health and you really care about that treatment. And by the way, that treatment is still necessary. So it's that part is very important. If your patient requires major treatment or an estimate that needs to be sent, exit them through the treatment coordinator if you can. If you have a treatment coordinator, if not, the front desk person, the person who's working at the front desk. And if it's an extensive treatment plan, take them into a consult area or a private area. Don't have them make major decisions at the front desk when there are people in the reception area. Not many today because of the pandemic, but it's much easier to have a one-on-one conversation with them. The treatment coordinator then will prepare the estimate and prepare the patient by explaining how she or he will assist them, as well as make the financial arrangements at that time. They need to be set, and the treatment coordinator will follow up with the patient within 2 weeks. But set the time Tell the patient when you're following up with them, so the patient expects that phone call, and then follow through with the treatment. I suggest putting it on the calendar or some kind of diarized system, so that that in that 2-week time frame, when you say you're going to call that patient, call the patient because they're expecting the call. Emails and text messages are okay. They're not great. So I would suggest certainly send an email if you can't get in touch with them, but try the telephone first. Because remember, these people are more or less in active treatment. So you want to follow up with them as quickly and as best as you can. The importance of your daily huddle is extremely important to help plan your day. But there's some things that need to be done before that huddle starts, and that's making sure that everybody comes with their audited charts, paper-based charts, or at least they have gone through the charts on the schedule, and to look for certain things. So identify any patients that have outstanding treatment, and then plan that discussion. This also alerts, if you have a treatment coordinator, it alerts the treatment coordinator that this discussion needs to take place, as well as I always identify when a new patient is coming in, because I think the treatment coordinator should be the person who introduces the patient to the office and perhaps gives them a little tour of the office and just welcomes them and gets them prepared for everything that's going to happen. If treatment has been prescribed in the past but wasn't talked about ever again, so that's the 11th discussion that I was talking about, then the patient thinks it wasn't necessary. Because believe it or not, they're thinking, oh, well, they didn't mention that crown, so maybe I didn't need it after all. So that's why the importance of repetition, as well as consistency in communications, is so critically important. Because otherwise you have to work 10 times harder to convince the patient that they have an active condition in their mouth that requires treatment in the first place. When you're sending estimates, tell the patient that the treatment coordinator will call them the next day. So what I'm referring to now is not necessarily the major restorative treatment plans that we think of going through a treatment coordinator. But from time to time, the ladies at the front desk or the gentlemen at the front desk, whoever's at the front desk will send out a pre-estimate for, say, for example, extra scaling units, or they just need a few fillings done. So it's not necessarily a major treatment plan, but it's still a treatment plan nonetheless, and it's an estimate. Those need to be followed up as well. If the treatment coordinator is available, she or he can speak to that person, that patient today. Now, that's the best possible time to speak to them. But if that person's not available, then say, our treatment coordinator, Debbie, will call you tomorrow, and she will discuss everything with you. And then the following day, the treatment calls the patient and says, "I am Sandy, the treatment coordinator from Jones Family Dentistry. I'm calling to let you know we sent an estimate to your insurance to see what they might assist you with." Those are some key words, by the way. "And I will be following up with you in the next 2 weeks to see if I can be of further assistance." So it's navigating and helping the patient to understand the process. And then the patient's got the reassurance that, wow, they're really on top of things and they're following up with it. So the key, of course, is managing your patient's expectations. It tells your patients that you're organized and that you're on top of this. It also reassures the patient that you care about them and you care about their health. And by the way, they need that treatment because there's an active condition present in their mouth. Call the patient within 2 weeks. Don't wait for a month. I've seen this happen over and over and over again in offices where they'll wait for a month. And of course, now the patient's forgotten about it, or they have moved on to other things. They have other needs, especially now kids are going back to school, all the back to school shopping and things like that. And then you'll reach the holidays, around December, and they've got other things, priorities in their mind. So call the patient within 2 weeks. Don't wait for the month, because that's what insurance companies want you to do. I've already mentioned that insurance companies will delay the approval for up to 1 month. If the treatment coordinator is busy or with another patient, say to the patient, "If you give us your permission, we will send an estimate on your behalf to see what your insurance might assist you with. Debbie, our treatment coordinator, will be contacting you to follow up with." this first part of this sentence, I ask treatment coordinators when I'm training them to memorize this. And I have included this with your communications handout this evening. You'll find that it's an appointment scheduling protocol, but at the back of it, there's also how to answer tough questions with great answers. But this sentence says a lot. It says, if you give us your permission, so it means that this is your insurance benefit, it's not my insurance benefit. I need your permission because you're the subscriber to the insurance. We'll send an estimate on your behalf. So we're doing this for you as a courtesy to you to see what your insurance company might assist you with. We're not saying insurance will cover, we're saying what they might assist you with, because they might not, depending on what plan has been set up with the employer. But the fact is that insurance assistance sounds a lot better than insurance coverage, because when you say insurance coverage, there's an assumption that it's 100% coverage, and it can't be. In some cases, I used to say that there was never 100% for major restorative. However, I will tell you, in Canada, the federal government does have 100% coverage for major, and so does the RCMP, but I think the RCMP benefits have changed fairly recently, so I can't say 100% for sure. So the treatment coordinator will then put the treatment plan into the computer. Any computerized system that you're working with, even if you have paper-based charts, always put the treatment plan in the computer as planned treatment, because then you'll never lose track of it. It's very easy to lose track of it if it's a paper-based chart and then you file the chart away and don't look at it again. So the treatment coordinator would then set up the presentation for the patient, schedule any appointments, including any consultations, secure commitment to the treatment, and then most importantly, secures financial commitment to the treatment at the time of booking. The handoff to the from the clinical area to the treatment coordinator or front desk coordinator is extremely important. It helps to maintain the dialogue and the momentum for the treatment. If that's lost, so is the patient's commitment. So it's very important that the clinical staff member says to the person at the front desk, Mrs. Smith would like to go ahead with that crown. We've prescribed a crown for her today. Could you please take care of the arrangements? And then you take it from there. But that is transferring the power from the clinical side into the admin side. And that's a key thing to remember. Your hygienist is a service provider. Remember that they're involved in the initial patient treatment screening in many cases. Patient education on clinical needs like bone resorption, gum disease, and they make the link to systemic health. They maintain the documentation of periodontal health, and also they're actively involved in continued osseointegration for implants and prevention for post-treatment infection. So their role is very similar to the role of a registered nurse. You know, if you've had surgery, a registered nurse will see you to help the healing, enhance the healing, and then the doctor makes the big decisions, and the registered nurse will be the person who helps to enhance the healing. Studies show that 65% of restorative care comes from the hygiene chair. So in order for the hygienist to be actively involved in this, prepare the patient for the doctor's discussion, start the discussion with the patient, and then have everything ready. Now, hygienists can't necessarily give the clinical diagnosis. They can give a hygiene diagnosis, but the clinical diagnosis that the patient needs restorative treatment has to come from the doctor, but have the patient ready psychologically, emotionally. Take pictures if you know that an x-ray is needed, and get the order for the x-ray as well while the doctor's in there. But take any intraoral pictures, give them to them. Now we can email them to the patient after as a follow-up. There's lots of great things you can do with technology now, which really helps the patient understand the need and helps you to follow up with the patient. If you know predetermination will be needed, take the x-ray. Any involvement with cusps or cracks in the tooth require intraoral pictures. And also what the insurance companies are starting to do now is asking you for the entire treatment plan. You may be sending in a pre-estimate for a crown. but they're going to want to know everything. What's your future recommendations? Now, the reason for this, once again, is to delay the claim, to make it more difficult. But we have to sort of go along with what the insurance companies do, because remember, you're the advocate for the patient. But this is also one reason why it's so good to have, if you have the ability of having a treatment coordinator who works at that position only, not switches back and forth to different positions, then he or she will have the time to follow up with the insurance companies. I always say to treatment coordinators, to try to add a hygiene program to every major restorative case. This should be also recommended by the doctor. Once again, using the registered nurse analogy, it's like telling the patient, we've been doing all this major restorative work. This will help us to make sure that the gums are in really good, healthy condition, to make sure that the major work lasts as long as possible, because you really want this to last. It's kind of like a warranty, but do not say warranty. In Canada, it's frowned upon because you can't really guarantee anything in dentistry, but you can help the patient understand, I would like to see you to see my hygienist every 3 months as a follow-up, to make sure your gums are nice and healthy and strong during the whole process. This helps you to closely monitor the success of the case as well, and the maintenance of their oral health. It can serve as an extended warranty. Once again, I said, try not to use that term, but protects their patient's health and their investment in their health. It also elevates the status of your dental hygienists to be the regulated healthcare professionals that they are. So when the doctor comes into the operatory, describe your findings, and you can give your dental hygiene diagnosis, but you can also point out certain concerns that the patient has. Have everything ready for the doctor. A sample discussion may be Dr. and Mrs. Smith has some concerns about her lower left molar, or Dr. Jones, Mr. Jones would like to talk to you about a crown on his upper right molar. So you've started the discussion, and then the doctor will confirm the findings and give the actual official diagnosis and prescribe treatment. Or Mr. Jones has made great progress on his gum disease and has now got everything under control. So celebrate the successes as well. Clinical assistant, patients view your clinical assistant as an extension of the dentist. A good clinical assistant can, of course, increase or decrease the efficiency, and which affects your bottom line, of course. But the clinical assistant has unique opportunity to influence patient acceptance and provide dental health education. If anyone is a clinical assistant, they can probably attest to this. Often a patient, when the doctor leaves the room, will turn to the assistant and ask them certain questions. It's not that they don't trust or believe the doctor, it's just that the doctor is sort of up here, and sometimes they feel more comfortable speaking to the assistant. So remember that they are part of the clinical care anyway. So the assistant will make note of any concerns and interests that may have been expressed when the doctor's not in the operatory, and bring these to the doctor's attention during the examination. You can place educational brochures in the patient's hand. Now it's more expedient to give them a link to a website. If there is more information on that website, make sure that it's a website that you trust as well. Better yet, if it was on your own website, and you have specific articles about that type of treatment, then that's even better to refer them to your own website. It encourages the patients to follow up with home care instructions as well, and makes the important ask for referrals. And by doing that, it's very, very easy. All you need to do is say, Mrs. Smith, if you have friends or family who are looking for a really good dentist, Dr. Jones is great, and would you like some business cards? And we'd be happy to welcome them into the practice. A key thing that the assistant needs to do as well, it is part of the entire case acceptance process, is gain informed consent. So express consent is written consent. So make sure that the patient understands the procedure, as well as the risks and consequences of the treatment and what to expect. And also what to expect if they don't follow through with the treatment. That's important to remember when you're talking about this. And also, you'll notice on this consent form that they accept the treatment or they decline the treatment. It's a really good idea to have a signature if they decline the treatment as well. And that just proves that you have informed the patient about their treatment and what they need and what the prescribed treatment should be. And they have made the informed choice not to follow through. When you're doing chart audits, making sure your chart audits are done before the morning huddle, that's really, really important. So discussing who has any outstanding treatment, then start the discussion with the patient and who's going to be talking to the patient. Escort the patient to the front desk or the consultation area, and have everything ready for the treatment coordinator or front desk coordinator. I've seen this done several different ways in offices. Chair side discussions are equally as good, as long as you can sit the patient up and be knee to knee and eye to eye with them. Don't have them laying back in the supine position because that is a very threatening position and the patient's not really hearing everything properly. So when you escort them to the front desk, do the handoff and say, Debbie, Mrs. Smith would like to go ahead with the crown that the doctor prescribed. I've taken the x-ray and intraoral picture. Would you please assist Mrs. Smith with the details? So that empowers the front desk person. That is the transfer of power from the clinical area. So during your daily huddle, there should be an assistance chart review, a hygienist chart review, discuss any new patients that are coming in, where the referral source was, any background information if you have it, any financial concerns that they might have. So therefore, would they need a consultation? Do we have any emergency times available? If you have a very busy office, then you need to know where to put emergencies, because emergencies can be senior emergencies the day of and then converting them maybe to possibly a new patient. If they don't have a dental home. If they have a dental home, then that's fine. The treatment coordinator will be looking to see if there's any outstanding predetermination on that patient's chart. Is the patient booked for any outstanding treatment? And what's the status of the predetermination? Has it been followed up with? Do you need to call them? Are financial arrangements made in place, or are they needed? One key thing to remember with predeterminations as well is most predeterminations are only valid for 90 days. So if you've been waiting a month or another month, whatever, and you haven't been able to get in touch with that patient, then you may need to resubmit the predetermination. It may not be valid if it's been left too long. So that's another key thing to keep in mind as well. And then to track your case presentations. Now in your handout tonight, I have included an Excel spreadsheet that will help you to track your case presentations. And the important thing, of course, is the date, the patient's name, the treatment, what's the estimated fee in dollar value? Do they have insurance? If so, how much is the insurance company assisting the patient with? Was the predetermination sent? So then you know when to follow it up. Is it booked or pending? And what I suggest putting in that particular column is the dollar amount again, because your office manager or the doctor may want to track how much you've got in pending treatment. I'll give you another quick example. I realize I'm almost to the end. I'm 4 minutes over, sorry, but we're almost done. I was in an office where the doctor, we have a tracking process, or my company does, that we put in place, and the treatment coordinator was putting these reports on his desk, and he didn't necessarily have time maybe to look at them, but he always thought that she wasn't really doing much. She was just talking to patients all day long. And anyway, so I took those reports and pointed out to the doctor, look how much pending treatment you have for next month, or look how much in dollar value that you've, the lady that you think is talking so much, she has booked, $25,000 worth of treatment for next week. So, it just helps to justify the whole treatment coordinating process. It also helps you to follow up on it and see the dollar value of this entire process. Be prepared for objections to treatment, because they are buying signals. If they're objecting to treatment, It means that they're asking questions, which means that they're actually interested. Prepare yourself, be ready for difficult questions with great answers. I have included some of those on your handout this evening as well. Discuss other patients who might have been in similar situations, and use testimonials or videos if you have them available. You can say, be the expert, because of course you are the expert. So say, you know, my experience has shown this, or research shows whatever, and you can explain it to the patient because they trust you, they believe you. Remember, that's the key. I listened to our patients, they had a concern about that, and here's what I did to solve their problem for you. So if the patient says, well, maybe in 6 months, really they're saying no. So find out what the true obstacles are. The reasons for the objection could be maybe you haven't established the rapport, maybe not enough confidence, enough need, enough value in the treatment itself, enough trust, and so on and so forth. Or there's no urgency to buy right now because they don't think that there's a problem. So again, using your visual aids. If they say maybe in 6 months, what's going to be different 6 months from now? So think about that. The real reason could be that the patient isn't the true decider. They need to speak to their spouse or their loved one. The patient doesn't have the money. You can solve that by giving them a payment plan or preparing a payment plan. The patient's afraid it's going to hurt. So you can reassure them about all the measures that you take to make it comfortable for them. The patient thinks that the price is too high. Talk about the value of the service and you know, how long it will last if you can predict that as much as, and also the patient has a dentist or a friend who can get it done cheaper. I've heard this as well in offices as well, but what they're really trying to do is trying to barter or trying to work out a discount. So in summary, thank you for allowing me to go over a little bit, but what you've learned tonight is what your case acceptance rate should be, how to present treatment and demonstrate the path for moving forward for patients, and how to make financial arrangements at the time of booking, and most importantly, how to close the sale.